Good afternoon. I am from the Wuxi County Hospital. So today, my topic is the management of the placenta accreta after HIFU treatment. I have worked in gynecology for 16 years. Before HIFU treatment, we used lesion excision or hysterectomy to solve the problem of placenta accreta. After HIFU treatment, as launching, we have not conducted the hysterectomy because of the placenta accreta. First of all, so what is the definition for placenta accreta? Placenta accreta symptom, PAS for short, is a condition in which the villi of the placenta invade the myometrium to varying degrees according to the depth of the placenta accreta into the myometrium. It can be divided into placenta adhesion, placenta implantation, and penetrative placenta implantation. As for the prenatal diagnosis and screening, the following will be taken into consideration, including ultrasound MRI. It is not as symptomatic. And the treatment of the uterus and the placenta, if the vital sign is stable without bleeding, we can adopt conservative treatment for the bleeding, and we should adopt hysterectomy. As for the clinical management, and it can be developed and optimized in terms of prenatal management, delivery management, and post-delivery management of the uterus and the placenta. HIFU boasts advantages in HIFU according to this research. Let's have a close look at the research about 12 cases of the placenta accreta. That is placenta after vaginal delivery. And the results is that HIFU treatment did not significantly increase the risk of infection or bleeding. And none of the patients required a hysterectomy, and menstruation resumed after an average of 80 days. And 2 patients are pregnant again. And this is a multi-center study, 95 patients. 53 patients are treated by HIFU alone. 42 are treated by HIFU and DC. So there is no major bleeding occurred, and no patient required hysterectomy. All menses resumed within 3 months. During a 2 to 8 years of follow-up, 6 pregnancies in the HIFU group, and 8 pregnancy, there is no placenta accreta. And in one case, the placenta was not completely exfoliated, partially implanted about 3 centimeters, and the surface was successfully stopped after suture. So as for the indications for the HIFU of placenta accreta, first is MRI and Doppler. And second, the vital signs are stable without significant signs of vaginal bleeding or infection. Third, willing to preserve the uterus. Fourth, excluding the penetrative placenta accreta. If the placenta accreta intrudes into the bladder, it is not suitable for HIFU treatment. 5, that there is no serious comorbidities. And as for contraindication, the post-operative incision did not heal, bad acoustic pathway, and DIC severe vaginal bleeding or hemorrhagic shock, or patients with acute reproductive inflammation, or contraindication to medicine or surgery. There are advantages for HIFU in treating PAS that we should take good care of the energy and the focal region during HIFU treatment. It can ablate all the tissues all the lesions without any impairment to the myometrium. And the HIFU is non-invasive and non-damaging to endometrium. And a post-operative management strategy. And maybe the patient is worried about bleeding, infection. So it is important to conduct post-operative management. First, follow up. First, vital signs. The bleeding, temperature, the abnormal pain. Second, the ultrasound, MRI. And third, the anemia and infection index monitoring. Fourth, the secretions or placenta abscessions. Five, the recurrence of menstruation. What we are concerned about is the late postpartum hemorrhage. The procedures include open venous access, rehydrate and transfuse, hemostasis, open surgeries or laparoscopic surgeries. Infection is of high rate, so we should strictly control the surgical contraindications and use the antibiotics according to the principle of antibiotics use, and pay attention to the vaginal secretion. And part of the placenta accreta can be discharged naturally, and part of the placenta accreta should be dealt with DC. And we should pay attention to the principles for the DC. We should do it softly and gently under the hysteroscopy. And if there is a proliferation, and we can conduct conservative treatment if the vital signs are stable. But if there is bleeding, we have to do the laparotomy or laparoscopic amending. And as for the pelvic adhesion, especially for the patients with fertility requirements, we should protect the endometrium under the laparoscopy, and we have to use some bioadhesive materials to prevent the formation of readhesion, and closely follow up the situation of menstruation, if necessary, hysteroscopic or surgical separation of adhesion. So in summary, PASS with fertility-sparing treatment is popular, and it requires communications between the patients and doctors. And we should provide physical or psychological consultation for the patients who are worried about adhesion. HIFU is non-invasive, non-radioactive, and with very good efficacy on the patients. It can we should control and the indication with follow-up to avoid the complications. So the emergency plan is important. The safety of the patient is our first concern. So we have the complete emergency plan and a strong MDT team. Thank you. That's all for my sharing. Thank you.